clear out here a little.
I know there's a desk over there, but I'm hoping for a halo effect with Chancellor Mitchell.
Okay, yes, yeah, whatever side you like.
Whatever Ted wants. The backdrafting to Ted, yeah. Would you like me to start?
I'm gonna let's let
Let's
room
let
just
the-
because as people move out.
Usually they come running in to applaud, not leave like this.
Yeah. Oh, wait. It's
At
the
least my mother
changing of
were
the
here,
guard
not
here.
somebody.
Okay.
Okay?
Okay, you can get started. Thank you, Doctor.
Okay, Chair Huffman. Vice Chair Hinojosa, distinguished members, I am Dr. Paul Klopman, and for the last 14 years, I have had the privilege of serving as the President, CEO, and Executive Dean for the Baylor College of Medicine. This is my 8th appearance before this committee, surprisingly enough. I should get a medal for that, I think.
Yeah, you should.
I'd like to thank you for your continued support and investment in our Texas medical students. For over 55 years, Texas has partnered with Baylor College of Medicine to educate and train the next generation of Texas physicians. Our institution was founded in 1900, and we will celebrate our 125th anniversary this fall. From the beginning, our goal has been to provide innovative education and training experience for our learners. Our recent expansion to provide medical education in Temple, Texas, through our partnership with Baylor Scott & White has been very, very successful. In 2023, we matriculated our first class of 40 students to the Temple campus, and in 2024, we admitted another additional 40 students. We will continue to expand until we reach 160 students in 2026, and the students have had an absolutely outstanding experience. In addition, the Rural Health Family Medicine Residency Training Program that we started in Lufkin in 2022 is preparing our graduates to provide primary care for patients in rural communities in Texas. Our goal is to seek further opportunities to expand these rural residency programs in other parts of Texas. Senate Bill 1 builds on your investment and generously supports our continued growth in the Temple community. Your support has allowed Baylor to develop other innovative pipeline programs to address the physician workforce shortage in Texas. Our unwavering commitment to the students of Texas is to develop and maintain a best-in-class medical education platform that will encourage and develop the next generation of health professions through our STEM plus M efforts. This is reflected through our innovative decades-long arrangement with public schools throughout Texas, where Baylor has developed the curriculum and trained the educators for middle and high school students to excel in health professions. Ryan Middle School and Rusk Middle School in Houston, similar schools in the Rio Grande Valley, Stafford, Corpus Christi, Midland, Temple, Belton, and the nationally recognized DeBakey High School are a testament to this effort. Your support allows Baylor to keep tuition among the lowest of all private schools in the country. Our students also graduate with some of the lowest debt burden of any medical schools in the nation. Our partnership with the state is entirely focused on the support of students from the state of Texas. The state pays only for the full-time Texas medical students and only for the core mission of education. You do not pay for out-of-state students. You do not pay for our buildings, improvements, purchase of land, tuition bonds, or special items. What is the state's return on that investment? Because of more than 50-year partnership with the state of Texas, 90% of our medical students today are from Texas. And 50% of our MD alumni have remained in Texas to practice, helping alleviate the state's physician shortage. By most rating agencies, and they're all variable right now, Baylor College of Medicine certainly ranks in the top in the state of Texas and is among the top for primary care. As a consequence, we successfully compete for and are awarded more NIH funding and other federal peer-reviewed funding than any other medical school in the state of Texas. We bring back dollars, those tax dollars that have all been paid by Texans, and create many high-paid jobs through our workforce, which promotes economic opportunities in our communities. We do an economic study like most medical schools, and we provide about $5.8, close to $6 billion of economic impact across the state. So I just want to conclude by thanking you for your support of formula funding for all medical students, for your support of GME funding. As you heard earlier, we were talking about GME funding through both formula funding and GME expansion grants, for your support of CPRIT, for the new initiatives like the Dementia Prevention and Research Institute and the Texas Epidemic Public Health Institute, which has really been a dramatic improvement in how we manage pandemics in the future, for addressing the mental health challenges facing Texas students with the continued funding for the Texas Child Mental Health Care Consortium, and finally, for your support for the new state's Texas Space Commission. You may know that we have a very large NASA grant to help deal with the issues of long-term space travel. So this concludes my remarks, and I'm happy to have the opportunity to be in front of you and would love to answer any questions that you have.
Thank you. Thank you for being here, Doctor. Senator Flores.
Thank you, Madam Chair. Dr. Kloppen, thank you very much for being here and the work that you do. And I just want to express my thanks and appreciation for the work you do collaboratively, especially in the Temple area. And of course, your primary emphasis, as we heard you just testify, is primary care physicians. Is that correct?
Well, I think we have two emphasis key foci. One is really we are a research-intensive school, and I think people know us for that. People forget that we actually have a big impact on primary care physicians. We have one of the largest family medicine programs. We have the largest pediatric training program, the largest pediatric hospital, and we have a great OB-GYN program, and we have family medicine now in rural Lufkin. We would like to expand the rural program. I think we heard from Chancellor Mitchell. Ted, I think they do a great job in West Texas. But, we need primary care everywhere. The key with primary care is finding role models so that physician trainees want to be primary care physicians. That's the hardest part. A lot of medical schools are created with the idea of creating primary care physicians, but unless you have a role model in front of them so they see a glide path to the future, they often don't choose it. So there are a lot of primary care programs that end up creating specialists that move out of the state. So we try very hard to put in front of our trainees primary care role models so they can be attracted into the field.
Thank you very much, and I appreciate that effort. And as one of the most critical spots in medicine is, of course, rural medicine, but
yes, yeah.
Throughout the state, it's primary care and family doctors.
I agree.
Thank you very much.
It's a national issue.
Fully support.
Thank you.
Senator Zaffarini.
Thank you, Madam Chair. Sir, on page 11 of your handout, you talk about your dual and BSMD degree programs. Are those funded by the state or combined sources?
Only the medical student components of those are supported by the state, so the graduate parts of those programs, the PhD programs, are not.
Thank you. And on page 12, you talk about expanding your program to other parts of the state. And I know we have heard and will hear from other health science centers
Yes.
and medical schools that are trying to do the same. How can we make sure that the medical schools and the health science centers that are expanding to other parts of the state don't overlap, that we can cover the whole state without overlapping?
So that's a really good question. To start with, creating a medical school, we've created a lot of medical schools recently in the state of Texas. It's not easy to do that. It seems like, we started school like a graduate program. The problem with medical education is you need to have a place to train them clinically. So if you don't have the volume for the clinical material, you can't train medical students or nursing students or health professional students. So the reason it works so well in Temple is we have Baylor Scott and White, a really outstanding hospital with enough patients to be able to train. The problem is when you don't have enough patients, it's really hard to do the clinical training. It's not, so as I said, it's not easy. I don't see us really fighting for areas right now. I mean, I think the biggest problem is getting to communities and providing enough clinical material, patients, that you can actually train clinicians. So when we go and look, so the reason we are in Temple is because it was perfect. There was a hospital system. Actually, Texas A&M had been there and was moving to Dallas. So it was like a win for everybody. I'd love to be in other parts of the state, but it would totally be based on whether or not there was the volume to do it. We wouldn't just go in there, and start a medical school next to another medical school if there weren't training slots. One of the problems, even though you look at the Texas Medical Center, the biggest in the world, there are 5 medical schools and nursing schools. We don't have the reason we went to Temple, we can't expand our class in the Texas Medical Center because there are not enough clinical slots to train people. So at this point, for new medical schools or new clinical training programs, the only way they're going to be successful is if you go into a place where there's enough patient material where you can actually train them.
Can I just, because I don't want to let that drop,
Yeah.
those clinical spots for the med students, do you have an exclusive, does Baylor have an exclusive arrangement with the hospitals?
Yeah,
Those slots?
yes. In some cases, yes. In some cases,
Yeah.
in some cases, no.
Okay.
You know, in our traditional one, we were the first. For example, look at the VA hospital. The very first academic affiliate in the United States was with Baylor and the VA hospital.
Right.
UT has a ward in that hospital, so it's not just us. The trouble with mixing schools in a same hospital is who's responsible. The accrediting bodies want to know if an error happens or if there's a problem with a trainee or a problem with a patient, who is the responsible body? And that ends up being, is it our faculty or their faculty? And so there are very specific requirements by the accrediting bodies for who's responsible for the patient care. So it's not as easy as you think. You know, there are some places that are trying to do multiple schools in the same hospital, but it has to be done carefully. You have to define who's responsible for the patient. It's not so easy.
Well, it's come to our attention that University of Houston medical students are having, in Houston, the largest medical center in the world, that, they're having
Yes.
trouble finding clinical spots. And we have to resolve that problem. And in my opinion, the solution is not building a new hospital. So
Well, I agree
maybe
with,
we need a new
no,
hospital.
I
but
agree
not
with
for
that. I agree with
Okay.
that. But, I have to
Yeah.
send my PA students out of the Texas Medical Center because we don't have enough slots to train them. We have nurse anesthetists. We have to send them out.
Yeah.
So just because it's the biggest doesn't mean that there's enough people. It's 10 million people a year, but there are 5 institutions, thousands of trainees.
Right.
So it's not an easy thing. So when we create a medical school, when you say let's start a medical school, the first question should be, do you have the graduate medical education slots for them when they graduate? And is there appropriate clinical material there to train?
I think that's another one of those problems that we need to wrap our arms around, Senator Colcourse. And I know, Senator Alvarado, you're interested because of the U of H factor. Because it's part of this same issue of how we continue on and prepare the workforce, but make sure our dollars are being maximized and utilized efficiently. Putting all this money into training and schools, but we need a finished product, and we want them to stay in Texas as much as we possibly can. But
I will say it's easier. So one of the questions you asked about expanding, we didn't expand. We would have liked to expand for years. So remember, we were the founding member of the Texas Medical Center, 1943. We've been there forever. We didn't expand our class size for 20 years because there was no room. Even as these medical schools were being formed, when they asked me, I said, we got to find places to train people. You can't just start a medical school without places to train people. We didn't expand our class until we found Temple.
right.
So our class expansion went from 186, same number in Houston, to 40 extra in Temple. Not because we couldn't find 40 slots to train people in Houston. Mm-hmm. So I'm just pointing out it's not, it was our problem too.
Right. No, I get it, but somehow we need to solve this problem. It has to be solved, Senator Colcourse. Everybody needs to work on this because it's critical because we're kind of reaching a critical point here where things are slowing down because I don't know how we.
Well, the other issue that Ted Mitchell raised was the GME slots. You've heard that.
Right.
Others.
That's another issue, but it's related. But
That's a big issue because right now in the United States we're training more trainees than we have places. I mean, more undergraduates than we have places to train them in graduate medical education, and so. You did a good job. The state did a good job of preventing undergraduate competition, but there needs to be limits on, for-profit entities coming in and buying slots because hospitals will.
Yeah, we're outlawing that, so I don't know how.
That's
but
great.
We're going to figure out a way to do it.
That's really important.
We're just going to write a.
That's
Senator
extremely
Hinojosa,
important.
got a bill.
Senator Hinojosa will take care of that.
Yeah.
And
Then we'll get back.
if I may just real quick question, that is, for a medical school to succeed, you really have to have hospitals that cooperate. They receive GME funding to be able to provide clinical rotation for the students and the GME residential slots. If they don't cooperate, but they take the GME funding, then the medical school is in trouble.
Yes, agreed. You know, it's a weird thing that started with the way GME was funded through Medicare, that with funding went to the hospitals and not to the schools. So it's been a strange, weird process throughout. What I thought Texas did was very forward thinking, is creating additional support for GME programs that were new. That was very forward leaning. Most states do not do that, and that helped expand the number of training slots in the state. So, I mean, you all have done a great job of thinking of creative ways to expand medical education in this state, and I give you a lot of credit for it.
And of course, some hospitals figure out a way to game the system.
Of course they do. I mean, of course they do.
Thank you.
Senator Zaffarini, I'm sorry we interrupted,
No,
but I
that's
wanted
okay.
to finish that subject. You can go ahead with
No,
your
I
question.
finished it. Thank you for your excellent work. So impressive.
Thank you,
Madam Chair.
Senator. Thank
Okay, Senator Colcourse.
Thank you, Madam Chair. Great discussion, and I think something that we really do have to attack, because we invest so much
Yes.
in the in the undergraduate medical student. And if they're disappearing, and you made the statement 50%, I believe, at Baylor College of Medicine,
So,
leave.
yeah, so that's a rephrase that. So
Okay.
there's nationally, that's a pretty standard number. If you look at graduates of the medical school, about 50% stay in the state. If they do your residency program in the same state, so medical school and residency, it's 75 state. What the difference with us is that, and this is an amazing statistic that I just looked at, for us to fill a class of 200, we have 226 medical students, 13 are MD PhDs, so 213 pure medical students. We only make an offer of 245. 90% of the kids that we offer a slot to take it. We're their number one choice. That's kids from out, those are Texas kids that are out around the country. So not only are we recruiting Texas kids to stay here, but we are recruiting kids that are in private schools all over the country that are from Texas to come back to the state of Texas. So we're like a magnet for those kids, those Texas kids. If you look at who turns us down, where do they go? They leave the state. You know, so we're not really competing with the state schools. We're competing with private schools across the country. But because you all help subsidize our tuition, and our tuition is very low. It's the same as the average of UT Southwestern and UTMB. It's like $19,000 a year. Tuition fees is $25,000. My wife is the dean of the Duke Medical School. Tuition fees there is $85,000. Anybody who's got a brain and gets into a Baylor or Duke, I would think they'd come to Baylor. Now, my wife and I fight about that, but the fact is, it is a real bargain and an attractant.
And so the state back in the 1960s decided to make the investment in Baylor
1969.
College of Medicine to say that we're going to supplement that again, almost putting those medical students on scholarship, if you will.
No, they are on scholarship.
Yeah.
It's supported by the
At
state.
every state university, if you go to a state university, you are on scholarship from the people of the
Absolutely.
state of Texas. And that is an investment that we make in our future, and the children are our future, and young people are. So just a couple of follow-ups. If you didn't have that state
Yeah.
funding, would you educate less medical students?
Oh, no. What we would do is we would be like every other private school. Our tuition would be $85,000 a year. If you make the difference between what it is and what a private school, like a comparable Duke, Vanderbilt, Stanford, that's $60,000 a year times 900 students is $54 million a year. So that would cover the exact, but what we would be doing, we wouldn't have 90% Texas kids. We would look like every other private school. We'd have, 20% kids. We would be a national school. Kids would be coming from all over. We wouldn't be retaining the top talent of the kids in Texas that want to go to a private school but stay in Texas.
So stay with me on these rotations and GME slots. Are we utilizing rural hospitals at all? I know Temple is considered rural. I think that we have to start thinking outside the box. Obviously, UTMB uses the prison system
Yes.
as a customer.
Yes.
We pay a lot for that. We pay a whole lot for that. I think we pay above what we should be paying for them to have enough patients to round on, right?
Yes.
So we need to be
you know this,
creative in how we approach this. We do have some new mental health hospitals coming online throughout the state of Texas, so that might be something that we can utilize and kind of come up with a roadmap. And I would love to have some creativity from the medical world. I do think that the medical world is going to shift here. We're seeing a sea change post-pandemic. So I'm going to shift very quickly about research and different things.
Sure.
The thirst that we see from our constituents, when I make speeches as the chair of Health and Human Services, and I talk about chronic diseases, things that we should be looking at in our food supply, things that we should be considering, kind of turning things upside down to really look at what the medical industrial complex has done, because it has become very large and unwieldy. And sometimes we don't like to look introspectively to say what we've done right or wrong. I think RFK Jr. is going to be a breath of fresh air. I think he's going to kick over a few rocks. Here we go. So I'm hoping that we get there, okay? I'm hoping that we think about what's in our food supply, what we're doing. Other nations are doing this. We're not really leading on that.
Well,
Would you agree?
Yes, I do agree with you on a lot of that. We have the Children's Nutrition Research Center. We're the only academic institution that
what I'm
actually
talking about.
focuses, and we have been focused on food supply for a long time. We collaborate with Texas A&M on flood-resistant food supply, things that we can do. I agree with you, by the way. And I also think that there's some things that we can do that are very technical, that have come out of the advances in medicine, but we have not been able to apply to individual patients is very much.
Doctor, and we spend more money as a nation than any other nation in the world, and our results are not very good.
I agree.
In fact, our metrics are down. Last one I
agree.
looked at, number 60th in the world, and we
Yes.
spend more. We're the most developed country in the world. We're going to talk about a lot of money going to our med schools. I challenge all of us because the people deserve better. And we always say Texas does everything better. So let's lead on this. And so that's my last segue into COVID. It's seemingly, and this happened in 1917, where once we got past the pandemic, no one wanted to look backwards. It's documented. No one wanted to look backwards. They didn't want to say, now, we've had many books since then, the things that we did right and wrong. My question to you is anybody doing research on long-term effects of lockdowns? Long-term,
Yes.
what did the COVID vaccine do or not do? And I know that everybody gets real nervous and says, you're stepping on toes. We have to step on toes. Nobody denies that myocarditis rose. These are undeniable facts. The charts show it. The data shows it. Are we doing anything about that?
Well, yes, I think not enough, and I think your points are very well taken. We got funding for long COVID clinics because there's a lot of long-term consequences of COVID, and so we're very focused on that. With the mental health funds that you all provided specifically are really to address the problems with adolescent isolation and mental health issues that were a specific result
100%.
of the COVID pandemic. I don't think anyone would argue that one of the biggest mistakes we made was that we didn't open up schools fast enough. And I think that was because we didn't know enough. It was a new virus we were unsure of, and the teachers were very afraid, as they should have been. It's not so much that the kids were having problems, but the teachers, the older population, was at higher risk. So I think we made mistakes during the pandemic, 100%. We also had some new advances that were pretty good, and now we got to figure out, as you say, what are the long-term consequences. The good news is that we do have better databases now for looking at complications from vaccines. So we should be able to pick up complications sooner than we did before, because now we used to do phase 4 trials where you have an enroll a certain number of people. Now we can report complications all the time. So I can figure out for myocarditis how many have been reported post-vaccine. I can look it up on the national database. And you're right, there's some things that are going to crop up for sure that we didn't really know.
I look forward to working with all of y'all. Texas leads. We spend a lot of money. We've talked about Houston being the premier medical center, maybe in the world. And we really have to attack this. We have to be willing to say we probably need a war college to look back and say what we did right and wrong so that future generations don't repeat our mistakes. Thank you, Madam Chair.
Thank you. Senator West.
Thank you, Madam Chair. Dr. Klopman, let me ask this question. And we've been talking about these slots and probably spent about 30 minutes talking about them. What's happening in other states? Are they having similar problems, or have they found any solutions that we could use here in the state of Texas?
For GME slots, you mean?
Yes.
Yeah, so I think I think this state has done better than most states. When I was in New York, before I came to here, I was in New York in Manhattan. They opened up slots to for-profits, and it was a disaster. And one of the things that you all did very, very intelligently was limit the opportunity for Caribbean medical schools to come in and buy UME slots. The same thing needs to be done on GME slots. I don't think there's another state that's doing it better than Texas. There are states that are definitely doing it worse than Texas, and New York's one of them. So I think the key is understanding that there, especially in Texas, with the number of new medical schools that have been formed, there's a need for more GME slots to support them, and so we do need to protect those slots. And if you can increase the funding to support them, that would help. I mean, that would help. That's, I mean, at the end of the day, we do have to find a way to pay for the medical student that graduates to be trained as in their specialty. It's an expense. When we think about making a medical school, people don't really think, oh, by the way, we have to train them further beyond their 4 years.
So what you're saying is that Texas is creating the best practices for the rest of
I think so, absolutely. I think they are. Through the GME expansion, it was 2 sessions ago, that was a major step forward that most states do not do, and almost none do. So that was a major advance. And you should be congratulated on that, because that was for everything. I remember my first 2 or 3 times here, we talked about this. We go like, we don't have enough place to train people. We don't have enough people, slots to train people. You all came up with the support for that. So that was, no other state had done that.
Thank you very much, Madam Chair.
Thank you. Senator Hall.
Thank you. Just a quick follow-up on Senator Cole. Of course, it's so important that we recognize what we've done right and what we've done wrong.
I agree.
We've talked about on a number of things. If we don't recognize what we've done wrong, we're going to do it again. And I do hope as we look back, we will look at what was the government's role. You mentioned the people were scared. They didn't want their kids to go to school. Well, why were they scared? Was it possibly because the government misled them with information or put out bad information? And what role did the government have by paying bonus payments to hospitals for having COVID patients, where we now know that they had lots of people who didn't have COVID, but it was an opportunity for those big bonuses they got? And I think that kind of thing needs to be included in whatever we do in a look back, to be honest across the board. What was really, how beneficial was it to drop the safeguards in the development of medicines or vaccines and rush it to the market? So that if it had no impact, then maybe we can do it again next time. But if it did, we want to make sure it's understood so we don't repeat it.
I don't disagree with you at all. I mean, I think looking back on what we did is best practices. It was I just, as you were saying, or before Senator Coker's left, that was a tough time, and 1.2 million Americans died during that period. So we made a lot of mistakes because it was like being in a battlefield. More people died from COVID during that period of time than died from all the wars. So it was tough on everybody. But I think, as you said, it makes sense to look back at what we did right and what we did wrong. I totally agree with you.
Thank you. And one of them is, really, more people died with COVID than all the wars, not necessarily of.
No, I get that. The way, we won't debate it, but.
All right. Thank you. Great discussion. Thank you very much for being here, Dr. Klopman, and
Thank you.
Great work that Baylor College of Medicine does
Thank
for
you
the
so
people
much.
of Texas.
Thank you.
You so much. All right. So we will now start with the University of Texas System Administration.